My name is Niklas Danielsson. I work for UNICEF for headquarters, but I'm based in the regional office in Nairobi. And I work particularly with coverage and equity in immunization programs, and also with health system strengthening to improve immunization outcomes. I would say that inequities or fairness in immunization programs has always been important. But you can also say that in general, as immunization programs become better, as they achieve higher coverage in a country, equity becomes increasingly important, because without achieving also equity, fairness across population groups and across geographical areas in the country, you cannot progress coverage more. First of all, immunization programs are funded by public money, which means that they should benefit everyone in a country. And so that's important. There is an aspect that all children should benefit. So we have an obligation to try to reach every child. But it's also important for disease control measures, because a disease like measles, for example, that requires very high coverage with vaccinations to have what we call herd protection, when unvaccinated people are protected because most of other people are vaccinated. That is not possible to achieve unless you have a very good equity in your uptake as well, because measles require 95% vaccination coverage. I would like to take two examples. One is Uganda, that conducted an equity assessment about 2 years ago. And they were able to very systematically identify both geographical areas, but also populations who are unvaccinated. And these were populations that could be defined from ethnicity or tribe, and some populations that could be defined because they belong to the same religious group or the same church, and so on. And that helped them a lot to target their immunization services to these groups. Another good example is Madagascar, where two large EPI surveys showed that the largest barrier to having better equity, better fairness in the delivery of vaccination service were the big gaps in cold chain. And that led to a big investment in cold chain in the country that improved equity. We think that they should plan conduct assessments in advance of investments in the immunization programs, or in advance of assessment or reviews of the program. So that could, for example, be a review of the multi-year plan. It could be an external assessment of the EPI program. It could be the formulation of Gavi support to the country, what is called full portfolio planning, when you look at the investment in health system strengthening and cold chain strengthening in the country. The very broad steps are first to diagnose, quantify the problem. So find out who are the under-vaccinated populations in that country. Where are they geographically, but also who are they in terms of the determinants of vaccinations that are associated with low vaccination coverage. So are these people who belong to a certain ethnic group? Are they people who live in urban poor areas? Are there certain remote rural areas? Do you have large populations affected by conflict? And this can be refugees, people coming over the border. It can also be internally displaced people, or it can be just people who are affected by conflict in a neighboring country because it's insecure in that area and it's more difficult to reach them with vaccination services. So it's really a mapping and quantification of the problem. The second step then is to identify the strategies and the interventions that can improve the situation. And there we provide what we call a menu of options. So there's basically a list of of strategies and also of tools and guidance where you can find information about interventions that are useful in different situations. And those recommendations that you make at the end of an coverage and equity assessment should then lead into planning and investments in the immunization program. And that's when you also have to think about monitoring and evaluation. And then it's very important to monitor both the implementation of the pro-equity and coverage improvement strategies that have been put in place, but also to look at possibilities of monitoring or evaluating impact in the end, if you can see improvements in both coverage and equity.